Hi everybody, I'm Danielle. I am going to present a video with some fun little add-ins, the differences between sex and gender. By background, I am a physical therapist assistant for the better part of a decade, and that is my target audience, is more of the physical therapy realm of everything. So let's jump right in, break it down nitty-gritty style. Sex is a biological concept based on characteristics such as differences in genitalia of male versus female, just to keep it very superficial of everything. Male penis, female vagina. Gender, on the other hand, is a whole new can of worms. It primarily deals with personal and cultural perceptions of sexuality via masculine and female, and how you just present yourself and who you believe you are. Some examples here is male and female, pretty stereotypical, I guess you should say. And then break it on down, more of a feminine male, just how he carries himself. This is all my perception of it. Hand on the hip, long hair, tight clothing, just very feminine characteristics. Then here is a more masculine female and a very feminine female. And then just to have a little bit of fun, everybody loves Will and Grace. So, great example, masculine female, masculine male, feminine female, feminine male, all into one. Everybody's together and just having fun. Okay, let's just keep the ball rolling. Behavior differences of males and females in the PT world. Men are just not as receptive to pain as women are, as well as people wanting to not confine and break the walls down from a male therapist to a male therapist, sorry. They're more apt to do it with a female therapist and just really create that rapport and interpersonal relationship to allow more effective healing. So just a couple little examples. This is that nice little female therapist wanting to just really get to know you, make you a better person, and heal you from the inside out. Here, a funny little cartoon, male therapist just not paying attention, pushing this poor older guy. In the parallel bars, it looks like he's about to fall and not have a good time. And here is one more example, male therapist really pushing his patient. You know, that's great, I do it too, but he's not really looking at what is going on. This poor guy's looking like he's in a bit of pain. He wants to push himself. He wants to please his therapist and everything else. So just, that's a little bit of the top of this whole situation between gender roles within the physical therapy world. Then moving on, as a therapist treating a patient with a more, I want to say, intense self-characteristics. So, for example, a female that identifies as a male, but doesn't matter where you're at in life or transition of anything, we're still going to have characteristics of our born sex. It's really an important part of our body makeup. So sometimes I've seen a very masculine female that identifies as male coming into the clinic and wanting to really please her therapist, and therapist just doing their job, rehabbing to the best of their abilities, but at the end of the day, at the end of the treatment, this poor person is just beat, and the therapist is not wanting to give that positive affirmation and positive feedback of everything that this person has accomplished within that treatment time. And as a female, you need that. So males, they're not very receptive of it. They could take it or leave it. So then further on, moving in healthcare, gender-based practice is so important for everything. Male, female, completely different, should be treated the same, but in retrospect, completely different makeup. Males and females recover, grow, and manage themselves very differently. For example, in physical therapy, women tend to heal and rehab faster than males when recovering, for example, from a total knee replacement, because women have tendencies to feel their role is to tend to the house and family, as females also tend to have a greater pain threshold, which, I mean, the whole having a baby situation, we all get that. That's probably not the most comfortable thing in the world. But that, pain thresholds is huge, and that leads to a faster healing and able for that woman to return to work or activities. We've all heard the funny scenario of the man flu, guy get a stuffy nose and just out for a week. Okay, before I jump on a huge tangent with that, let's just jump to gender-based care. Furthermore, new approaches as a research model should carry out more control groups of men versus women, male versus female, instead of mixed groups of both sexes, due to the fact that males and females react differently to medications, therapies, any interactions or anything. With that being said, this will greatly affect the therapist's or the medical doctor's treatment, intervention via diagnosis of meds, literally anything. And it should have a difference of male versus female with whatever that medical professional is trying to do. Furthermore, new approaches for medical training. There should be educational classes for healthcare practitioners to increase their cultural perception via in-person or their employer's intranet. So anything on the computer, small classes to fully educate yourselves, to increase the competence and improve care to all, regardless of their sex, sexual orientation, gender, and sexual identification. So hopefully this wasn't too confusing, fun, kind of keep you on your toes and interactive. So thank you.